Welcome to the All Sorts Podcast, The Learner. Today, we're going to take a deep dive into something pretty amazing, heart transplantation.
Yeah, it's quite a procedure.
You guys have given us some great sources for this deep dive, so we're going to try to really break down exactly what's involved in a heart transplant, what the recovery is like, what kinds of things affect whether it's successful or not.
It's really a life-changing event for people.
Right. And, maybe we'll even come across some surprising things along the way.
I think so.
All right, well, let's just start with the basics. What exactly is a heart transplant?
Well, you're basically replacing a diseased heart with a healthy one.
I see. Where did that healthy heart come from?
It comes from a donor, someone who has recently passed away.
Okay, so it's a pretty major surgery.
Oh, yeah, it is. And usually it's only done when other medical treatments haven't worked.
So it's kind of like the last resort.
Yeah, pretty much. I mean, if the heart's so damaged that nothing else is helping, then a transplant might be the only option.
Makes sense. And is this mostly for older people?
Not necessarily. It can be for people of all ages.
Really?
Yeah, it really depends on the overall health of the person. And of course, the health of their other organs, like their brain, liver, and kidneys.
Oh, right. I guess it makes sense. If your other organs aren't doing well, then maybe a transplant is too risky.
Exactly.
What are some of the reasons why adults might need a heart transplant?
Well, a lot of times it's because the heart muscle itself is weakened. That's called cardiomyopathy.
Cardiomyopathy?
Yeah. And that can, really affect how well the heart pumps blood.
Oh, wow. So what else? Coronary artery disease is another big one.
Where the arteries get clogged up.
Right. And then there's heart valve disease.
Okay.
Sometimes it can be congenital heart defects, so problems that people are born with.
Interesting.
Or even dangerous abnormal heart rhythms.
Wow.
Yeah. And sometimes a previous heart transplant might fail.
Oh, no.
And they need another one.
What about kids? What are the most common causes for them? It's usually congenital heart defects or cardiomyopathy for kids.
Okay. Now, you mentioned multi-organ transplants earlier. What's that all about?
So sometimes if the heart's failing because of some other problem that's affecting other organs too, then they might need to transplant more than just the heart.
Oh, I see. Like what?
Like maybe a heart-kidney transplant or heart-liver transplant.
Wow. That's a lot.
It's rare, but sometimes they even do heart-lung transplants.
Wow. Okay, so let's say someone needs a heart transplant. What happens next?
Well, first, they'll be put on a waiting list for a donor heart.
And how long does that usually take?
It can take a while, maybe several months.
I bet. You have to find the right match, right?
Right. It has to be the right size and blood type.
And what are they doing while they're waiting?
They're getting checked out regularly with blood work and imaging tests to make sure they're still healthy enough for the transplant.
Oh, so they're making sure they're ready to go when a heart becomes available.
Exactly.
Okay, so let's say they find a match. What happens then?
Then it's time for the surgery.
And how long does that take?
It can be a long surgery, maybe several hours.
Wow. And what are they actually doing during the surgery?
Well, they put the patient on a heart-lung bypass machine.
What's that?
It's a machine that basically keeps the blood flowing and oxygen going while they're working on the heart.
Wow.
And then the surgeon opens the chest, takes out the old heart, puts in the new one, and connects all the blood vessels.
That's pretty amazing.
It is.
So what happens right after surgery?
The patient goes to the intensive care unit, or ICU, to recover.
I see. And how long do they stay there?
Usually a few weeks. They need to be monitored very closely to make sure everything's okay.
Makes sense. Now, one of the sources mentioned inpatient rehabilitation. What's that?
So sometimes after the hospital stay, the patient might go to a rehab facility to help them get stronger before going home.
Okay, so they're not quite ready to go home right away.
Right. They might need a little more help to get back on their feet.
And once they do go home, how often do they have to see the doctor?
Well, at first, they'll have to go back to the transplant center every week.
Wow, that's a lot.
It is. But as they get better, they can go less often, maybe once a month, and then eventually just once a year.
Okay, so they're closely monitored for a while.
Yeah, they really are.
I guess that makes sense after such a major surgery.
Yeah.
What are some of the risks or challenges that people might face after a heart transplant?
Well, like with any surgery, there's always a risk of infection or bleeding.
Right.
And with a heart transplant, there's also a risk of something called allograft vasculopathy.
Allograft what?
Vasculopathy. It's a long word, but it basically means that the arteries in the new heart can harden and narrow.
Oh, so that doesn't sound good.
It's not. It can lead to heart attack or other problems, so that's why they do regular stress tests to check for that.
Okay.
Another big thing is that people who've had a heart transplant have to take immunosuppressant drugs for the rest of their lives.
Immunosuppressant drugs.
Yeah. These drugs basically suppress the immune system so that it doesn't attack the new heart.
Oh, right. Because the body might see the new heart as something foreign.
Exactly. But the problem with these drugs is that they can cause other problems, like kidney damage or an increased risk of cancer.
So it's like a trade-off.
It is.
Okay, so allograft, vasculopathy, and immunosuppressants. What else?
Well, there's also the risk that the new heart just doesn't work properly right from the start. That's called primary graft failure.
Graft failure.
Yeah,
That must be scary.
it is. And it's actually one of the main causes of death in the first few months after a transplant.
Wow. So there's also rejection, right?
Right. Even with the immunosuppressant drugs, there's still a chance that the body might reject the new heart.
And what are the signs of rejection?
Sometimes there aren't any, which is why they do regular biopsies to check for it.
So they're basically looking for signs of rejection, even if the person feels fine.
Right.
You mentioned opportunistic infections earlier. What are those?
Those are infections that wouldn't normally be a problem for someone with a healthy immune system, but they can be dangerous for people taking immunosuppressants.
Oh, right. Because their immune system is weakened.
Exactly.
So what kinds of infections are we talking about?
Bacterial infections like staph and strep,
Huh.
viral infections like herpes and hepatitis, fungal infections like candida and aspergillosis,
Wow. That's a lot.
and even things like pneumocystis and tuberculosis.
So people who've had a heart transplant really need to be careful about getting sick.
Yeah, they have to be really careful about hygiene and avoid being around people who are sick.
What about cancer? I remember reading something about that.
Yeah, unfortunately, taking immunosuppressants for a long time can increase the risk of some types of cancer,
Yeah.
especially skin cancer and lip cancer.
Makes sense. The immune system is supposed to help fight off cancer.
Right.
Okay. So let's say someone has a heart transplant and everything goes well. What kind of lifestyle changes do they need to make?
Well, the big one is that they'll have to take those immunosuppressant medications for the rest of their lives.
That's a big commitment.
It is. And they'll also need to be really careful about avoiding sick people and places where there might be germs.
So maybe not the best time to start working in a daycare?
Probably not.
What about food?
They need to eat a healthy diet, but they also need to make sure that everything is cooked thoroughly. No raw food.
Wow, so even sushi is off the menu.
I'm afraid so. Raw food can have bacteria that could be really dangerous for someone with a weakened immune system.
That makes sense. What about doctor's appointments?
They'll have regular checkups with their transplant team. At first, it'll be pretty often, but eventually it'll just be once a year.
Okay. And will they need to see any other specialists?
Yeah, they'll probably need to see an ophthalmologist, a dentist, and a dermatologist regularly, too.
To keep an eye on things.
Right.
What about exercise? Can people who've had a heart transplant exercise?
Yeah, actually, exercise is really important. Yeah. But they need to talk to their doctor about what kind of exercise is safe for them.
So no running marathons right away.
Probably not. But walking, swimming, things like that are usually okay.
So there are some limits, but they can still be active.
Right. And it's important for them to maintain a healthy weight.
Right. And I guess they need to avoid smoking and drinking, too.
Definitely.
What are some of the signs that someone might be having problems with their new heart?
Well, they should watch out for any signs of infection, like fever or chills or any changes around their incision.
Okay. So basically any signs that something's not right.
Right. And they should also watch for signs of rejection.
Like what?
Shortness of breath, fatigue, swelling.
And if they have any of those symptoms, they should call their doctor right away.
Absolutely.
What about long-term complications? Are there things that can happen years down the road?
Yeah, there are. Even with good care, people who've had heart transplants are at higher risk for things like high blood pressure, kidney problems, and even some types of cancer.
Wow. So it's really a lifelong commitment to taking care of yourself.
It is.
So what are the chances that a heart transplant will be successful?
Well, the good news is that survival rates have really improved over the years. Nowadays, about 91% of people are still alive a year after their transplant.
That's great. What about long-term survival?
The numbers are getting better all the time, but historically, about half of the people who had a heart transplant were still alive after 10 years.
Okay. And what are some of the things that affect how long someone will live after a heart transplant?
Their health before the transplant is a big factor.
Yeah.
And how well they manage those post-transplant risks we talked about, like rejection and infection.
Makes sense. Now, one of our sources mentioned something called the Penn Medicine difference. What's that all about?
Penn Medicine, it's a hospital system, right? They're known for their heart transplant program.
Okay. What makes them so special?
Well, they have a very team-oriented approach. They bring in all sorts of specialists to care for the patient.
Oh, so it's not just one doctor.
Right. And they also really focus on involving the patient's family in the care process.
That's great.
And they're big on education, making sure the patient and their family understand everything that's going on.
So they're really trying to empower the patient.
Exactly.
Yeah.
And they have a very personalized approach. They tailor the recovery plan to each individual patient's needs.
That sounds like a really good system.
It is. They also have great social workers who help the patients and their families with all the practical and emotional challenges of a transplant.
I can imagine that's a huge help.
Oh, yeah.
Now we have some data from the UK too, the NHS Blood and Transplant Report from 2021-22.
Oh, yeah. What did that say?
Well, it said that in that year, there were 179 adult heart transplants in the UK.
Okay.
That was actually an 11% increase from the year before.
So more people are getting heart transplants.
Seems like it. And the report also had information about all the different transplant centers in the UK,
Right.
like Birmingham, Glasgow, Harefield, Manchester, Newcastle, and Papworth. Those are the main ones for adults.
Okay.
And then Great Ormond Street and Newcastle do pediatric transplants.
Got it.
The report also had lots of data on survival rates and waiting times.
That's interesting.
Yeah. And they even looked at survival rates based on whether the patient had a VAD before the transplant.
A VAD.
Yeah, it's a ventricular assist device. It's like a mechanical pump that helps the heart pump blood.
Oh, right.
So if someone needs a VAD before their transplant, it can affect how well they do afterward.
Makes sense.
It's really fascinating to see how much progress has been made in transplant medicine.
It really is. From the surgical techniques to the medications to the long-term care, everything's getting better all the time.
And it's great to see that the data reflects those improvements with better survival rates and all that.
Yeah, but it also shows that there's still a lot of work to be done. There are still risks and challenges. We need more research.
Absolutely. So the learner, we've covered a lot of ground today. We've talked about what heart transplantation is, what the risks are, what the recovery process is like, and what the long-term outlook is.
And it's a lot to think about, right?
It is. What do you think, the learner? What really stood out to you about all this? What questions do you have?
Yeah, let us know what you're thinking.
This deep dive into heart transplantation has really been incredible. We've explored this amazing intersection of science, human resilience, and the incredible gift of organ donation.
It's really remarkable how far we've come.
It is. It's a complex journey with a lot of challenges, but also with the amazing possibility of a second chance at life.
And it's a journey that wouldn't be possible without the generosity of organ donors.
That's so true. Now, the learner, if you enjoyed this deep dive, I bet you'll love our other explorations here at the All Swords podcast. We cover all kinds of fascinating topics, and we're always trying to spark your curiosity and help you learn new things. So make sure you hit that like button and share this deep dive with your friends and family. And don't forget to subscribe to the All Sorts podcast on YouTube so you never miss an episode. You can also follow us on X, Instagram, and Threads for even more insights and discussions. Thanks for joining us.
See you next time, The Learner.